Hello, my name is Ann Mifsud and I am the Stroke Program Director here at Cleveland Clinic, Abu Dhabi. Today I will be your host for this episode of The Doctor Is In. Today we're very lucky to be joined by two exceptional people as we explore the personal journey to recovery of one of our stroke patients, Mr. Carl Davies. He is our special guest and he's a very resilient gentleman who himself sustained a stroke back in March 2024. And who has now devoted his time and energy to spreading a message of awareness and of hope. Dr. Seby John is a neurologist and neurointerventionalist here at Cleveland Clinic Abu Dhabi, and he was the physician heading the team who treated Mr. Carl. So good morning, both of you.
Good morning.
Thank you for being here.
Pleasure.
Happy to be here.
Right. So, and thank you so much for taking the time to be here, both of you. So, Carl, I'd like to start with you.
Okay.
Can you tell us what you remember of how the whole story began?
Yeah, it was just a very normal Monday at school. A very dull day. I went to school, did my job, came home, and then the gym with my son. I was at the gym doing a warm down. I felt a bit of a pain in my right head here. And the pain grew. I thought, I'm thirsty, so I'll try and move. I tried to move off the mat during a warm down, and I fell on my left side. And the pain grew, and the pain was just so intense. It was like a hammer being hitting my head, or some kind of tool. And I thought, I'm thirsty. I had some water. I tried to get to move. My left side again fell down. This side fell down on my face, and it's a port of my own drool. So I'm lying there on the mat, and then my son saw me on the mat, and. That for me is just the worst part of the whole day, is that I knew that I was poorly, but seeing my son see me, maybe near death, was just horrible. I paid the earth to get that memory erased from him. It was just so terrible, seeing him, seeing his face, seeing his father on the floor, lying there in agony.
Right.
So anyway, they called of course 911. And then they came, and it was all good. And so then my wife came along too, to the gym. And that was it. I came here to Cleveland, to ICU with your man here, Dr. Seby.
Right. And so at what point did you realize that you were probably having a stroke?
The guys at the gym came over and did the fast. So I saw that my face was down here, my arm was here, my speech was very slurred, and so I was told that, listen, it's having a stroke, okay. And I thought, oh God, okay, that was it really. But I knew that I was in good hands coming here, so I was reassured.
Right. And do you know what kind of stroke it was?
It was a brain bleed, I think, that then caused a subarachnoid.
I see. Okay, no, so it was a bleed anyway, yes.
Yes.
Okay, so, yeah, right. So that's interesting, right? Because bleeds aren't as frequent. So would you like to explain to the audience a little bit about what bleeds are like?
Yeah. Thank you once again, Carl, for doing this for the whole stroke community. So what Carl suffered is an intracerebral hemorrhage, which means a bleeding in the brain. So if you zoom out and look at the types of strokes, there are two types of strokes, right? There's ischemic stroke, which is basically when a blood vessel which is supplying the brain gets blocked, usually from a clot, right? And the area of the brain which is supplied by that artery begins to die. This is in contrast to a bleeding type of stroke, or what we call a hemorrhage, where a blood vessel bursts and then you get bleeding within the brain. So what Carl suffered is actually bleeding within the brain, and this was on the right side of his brain, which is why he's explaining symptoms of weakness on the left side, facial droop on the left side. So essentially he had the lesser common type of stroke, which is a hemorrhagic stroke. So if you look overall at worldwide numbers, about 70% is related to ischemic stroke, or the blood clot which I spoke about, and the remaining 30% is a hemorrhagic stroke. And there are different types of hemorrhages. You mentioned another important type of hemorrhage called a subarachnoid hemorrhage. But intracerebral hemorrhages, which is basically bleeding within the brain matter itself, is the most common.
Yeah. And you want to tell us a little bit about the emergency management of that?
Yes, so I'm glad the emergency ambulance system was called, because this is very crucial for our patients.
Absolutely, yeah.
And the
Exactly.
stroke community to know that this is an emergency and you need to get to the nearest hospital, which is hopefully stroke certified, as soon as possible. So emergency management, both for the clotting type of stroke and the bleeding type of stroke, of course, needs stabilization of all your vitals. So they would check your airway, your breathing, and your blood pressure, all these critical vitals. And then we proceed on to the specific type of stroke. So when you came to Cleveland Clinic, the first scan that you got was the CT scan, which is a very good test to look at, is this a bleed or is this a clotting type of stroke? And indeed, it showed very clearly that you had a bleed in the right side of the brain. So the emergency management in this particular type of stroke, where there's bleeding, is to rapidly control blood pressure to specified targets, because this is one of the interventions that we can do to prevent the bleed from expanding. This is one of the consequences of bleed, because they keep expanding in the early hours. So we need to bring the blood pressure down. Of course, we do other tests. For instance, you got a CT angiogram, and this is more to look at what caused the bleed.
Yeah.
So I would say the initial management is stabilize the patient. Specifically for intracerebral hemorrhage is control the blood pressure. And then there are numerous other factors that are looked into and meticulously controlled as the patient gets into the ICU in the first 24 to 48 hours.
Right, right.
Actually, sorry, what, at that point, what were my long-term odds of survival or prospects of long-term life post-stroke?
Very good question. So this, of course, depends on multiple things. First of all, it is the size of the bleed. Right off the bat, if you have a very large bleed, which is causing a lot of pressure on the surrounding brain structures, and it is even pushing on to critical brain structures, that's a life-threatening situation, right? So there's a very high chance of severe deficits and even death, right? So in your case, the bleed was not big to the extent that it was pushing critical structures, although there was certainly surrounding swelling around the bleed, right? So it of course depends on multiple other factors. It depends on your age. It depends where the bleed is, right? There are areas of the brain which we call eloquent areas, which manifest differently. So you could have a moderate or big size bleed in one particular area of the brain, and you may be reasonably okay, but you can have a very small bleed in other areas, specifically what we call the brain stem, and you can be severely disabled, right? So it depends on the location, it depends on the age, it depends what comorbidities patients have. So are they sick to begin with? Are they frail? Are they elderly? These all do heavily influence how you recover, and to your particular question, whether you survive the bleed in the first place.
Yeah, exactly. So I imagine, in those first few days, a lot was happening all at once, right?
Yes.
One moment you're healthy, exercising in the gym, and the next moment you're in bed and unable to move properly and dependent.
Yes.
How did that feel for you? I mean, do you remember what it was like in those early days?
I was aware of where I was and what happened to me. I knew that very, very clearly from doctors around me. But I think I was just scared. I was scared of long term. I was scared of being in a wheelchair for life. Scared of being disabled for life. But I knew I was in good hands. So my only I think thought was to stay here. Take the meds. Okay, be a good boy, and do as I'm told, and hope for the best.
Yeah. In fact, it's true. I always think that, it must be so scary. And us as physicians, we try to reassure, we try to encourage the patient themselves, the families, But there's only so much really that we can do to help and support. I mean, how do you see that?
Yeah, different patients are different. But once we see that our patients have stabilized in the first, 24 to 48 hours, we are always optimistic, right? Because strokes are, of course, devastating. They are very disabling. But the hopeful news, as in your case, is that most strokes improve, and they improve quite well. So as hard as it is for patients to see that at that moment of time, and especially their family, we do have the honor of taking care of you all even outside of the hospital. So when you come back in the clinic, we see the amazing progress that is made. So my approach is, never give up. If the resources support, of course, we advise intensive neurorehabilitation, and our patients will surprise you.
Exactly. And that gives us hope as well, and
yes.
the drive to keep going, I suppose.
Yeah.
So I suppose once the acute phase was over, then and you're medically stable, then you had to start the long, arduous road to recovery. So how did that journey go?
So I was then moved to Ream, for 4 months. So I moved at the end of March. I spent 4 weeks in ACU here, and I walked to Ream, and all I saw was just 4 white walls, thinking I'll be here now for another year. I had no idea if I'd be here for a year or half a year or a month or longer. So I'm here for a while, so I need to work hard. I need to work hard and just try to have maybe a more kind of open and broad mindset. That I've been poorly, I'm not dead. I've got a year now to get back on my feet again, a year to recover, a year to get better, and leave here, hopefully in a year's time, a better version of myself than I am now.
Right. And thank God it wasn't quite a year, was it?
No, it was July, so 4 months.
Yeah.
Yeah.
So clearly it involved every aspect of your being, right? Physical, mental, emotional. So what was the most challenging aspect for you, do you think?
I think being in a room, and not having my wife and kids nearby, I saw them every day. My wife, Kate, was amazing, amazing woman, was there with me all times. My kids too, but they come and see me for an hour or 2 hours, then leave me.
Yeah.
And so once that door closes at Ream, I'm on my own there for another day. And the care there was amazing, by the way. But once the door closes, you're on your own. You have TV and you have your bedpan as company.
Oh, gosh.
But I felt kind of exposed in a way that I was wearing a diaper, nappy, for a month or two. I was being washed and showered, by grown men, but so be it. This was now my new me. This is now my new normal, and being proud and being humble was important for me to lie there, get myself changed and showered, eat the good food, and just try to smile and survive.
Right. A lot of learning.
Yeah, a lot of dark days, a lot of self-reflection. I think a lot of kind of thoughts about the future, and fear about will I leave here in a year in a wheelchair, or I leave here at all?
Right.
And if I do leave here, what version of me will leave here? So.
And how did you handle the fear? That's probably most difficult.
I started to journal and write notes on my phone about how I felt, kind of like an emotional diary, if you wish. So, day 1, I'm still here, feel okay. Day 2, my left arm is not working still, fine. Day 3, still alive. Day 4, and so on. And it grew into a book.
Oh.
So I thought that for me was my catharsis. I can sit here all day, and I can mope, and I can cry, and I can be very, very down, or I can be proactive, and I can be full of self-care and self-love. So I just sat and wrote a book in my time there. Right.
And of course, thankfully, Carl has done very well, but of course, people are different. So are there some important points that you feel that patients and their families should keep in mind as they are going through the recovery phase of their stroke?
Yeah, so as I alluded to, there are multiple factors. I would say the location of the bleed, the age of the patient, if you have any comorbidities to begin with, frailty doesn't help. All these things do influence your recovery. But I think, as Carl has alluded to, this takes a village, right? So neurorehabilitation is a very key component of how this all pans out. So you could start rehabilitation as early as 24 to 48 hours based on how our patients are doing. So if they're clinically stable, we can start. And I would say you get excellent recovery in the first 3 to 6 months. This is when you maximize the opportunity to recover deficits and also, to improve quality of life. But even after that, you do still improve. Your gains may be not as much, but you continue to improve. Basically, you're exploiting neuroplasticity, right? You're relearning tasks that you've lost and you're learning new skills. So what I tell my patients is, stick it out, just put in your effort, and we cannot emphasize enough the need for a multidisciplinary neurorehabilitation team, right, which focuses on every area of your recovery. And that's usually how I encourage my patients.
Yeah, very true. And as you've sort of shown us already, there's no doubt that such an event is a life-changing experience.
Yes, absolutely, yes.
And although we say it, it's only someone like you who really knows what that actually truly means. So you've kind of mentioned a little bit already, but what is the key way in which you feel this experience has changed you?
I think unless you walk in my shoes, you have no idea how it is to be me, or be us as a stroke survivor. I've been through some dark days, some dark times, and I've been grieving the old me. But the old me is gone. The old me has gone. The old me, the golfer, has gone for now. The old me has gone forever. So I'm now a new version of me. And for me, it's about about hope and about being grateful for what you have. My bleed size may have killed me on that day in March. Okay, so then we were told by the guys at Ream that I might not walk again. I was walking by mid-June on my own, with a quad cane and an AFO. So for me, it's about hope and about fight. And end of the day, for me, I'm alive. My wife and kids are still there with me. I'm working now part-time, back at school.
Oh, good.
I can shower, I can wash, I can drive a car, I can get dressed, I can talk, and so I'm functional. But I know that emotionally I'm not the same person.
Indeed.
I'm more frail now emotionally. I'm very teary. I'm very I have some real dips in my days, but I'm here, and I'm alive. I'm functioning.
Indeed. So, as we draw to a close, so what final message would you like to convey to many patients like Carl who have had a stroke and to their families?
Two messages. One, I would say, is if we can step even before this, stroke is preventable, right? I think we need to know that majority of strokes are related to risk factors that can be modified. So specifically for intracerebral hemorrhage, the most important risk factor is high blood pressure, right?
Indeed.
And time again, we see patients who have extremely high blood pressure and the adverse effects related to that. So stroke is preventable. And second, the last decade or two has seen remarkable advancements, right? We are not nihilistic about stroke. Stroke is treatable. Whether you see the ischemic side or the hemorrhagic side, stroke is treatable. But it is key for the stroke community in general and our patients and the public to recognize symptoms of stroke, just like Carl did, and to come into a hospital as soon as they can so that we can give them an opportunity to afford the best treatments that will give them the best chance of recovery.
Yeah. And I have to say, although I hadn't met you until today, your fame does precede you.
Thank you.
Because, I mean, it's admirable the way that you have turned this, what obviously is a negative experience around, to something positive. And now I know you've dedicated yourself to raising awareness. And you also mentioned the book that you've written. So what is the key message that you want to give to other stroke survivors or other patients?
As my wife says, it is what it is. And we can't control it or change it. What happened to me, I can't go back and change that day in March. It's done and over. For me, it's about maybe, I think, mindset, about self-care and self-love, is that you can choose to lie in a bed for a year, okay, and be defeated and lose, or you could choose to fight and smile and work hard and work damn hard. And have faith in your team, have faith in your mental, have faith in yourself. It's doable. It's long term, it's painful, but with support and with love and self-care and a smile, it can be done.
That's wonderful. We've turned this around, really.
Thank you.
And so, Dr. Seby, thank you so much for taking the time out of what I know is a very busy schedule to be here with us today. And thank you, dear Carl. Thank you so much for coming.
Thank you.
To join, to share your story with us.
Thank you.
And finally, I'd like to thank you, viewers, for joining us today as we followed Carl on his journey. I'd like to remind you that Cleveland Clinic Abu Dhabi is a designated stroke center of excellence for the Emirate of Abu Dhabi. So our doors are always open to treat any patient who's experiencing a stroke. Stroke is a medical emergency. So if you think you or a loved one are having a stroke, call an ambulance immediately and go to the nearest stroke center without delay. Thanks again for joining us, and for now, goodbye.
Goodbye. Thank you.
Thank you and goodbye.